So when patients come into the office with severe low back pain and say they want to avoid surgery, it really becomes, did they have such a big injury that they don't really have a choice? And the choice becomes less and less available if you have a massive disc extrusion that's going back up by that nerve root and causing such compression that you're losing nerve function. If you're losing motor control, sensory, and reflexes, you may not have that option to avoid surgery anymore. But if you have a smaller disc extrusion that's not causing a massive amount of compression, you have some options. And those options are going to be ways that we can decrease some of this pain and inflammation, get you to function in your daily life without such severe pain that you can't go to work, you can't get through your day, and you're just miserable day in and day out. So different treatments we can do are things like heat, ice, electric, traditional physical therapy. We have traction, both the intersegmental that's going to rock the joints, get some motion and movement, or decompression that pulls the joints apart. When we're pulling those joints apart, we're trying to increase blood flow to that disc. If the disc gets more blood flow, it can speed up its patching or healing process better. Also, that space, that opening and closing, is going to bring more nutrients to the area, and those cells that are trying to eat up that disc material have a better chance to work. Decompression will oftentimes get that disc to migrate away from that nerve root to make it less painful, less irritation. We can then combine things like low-level laser therapy or Graston Technique to decrease the muscle spasms and tightness around the area. We might have to consult with a pain management group for injections into the joints to decrease some of the inflammation, to give you more movement and block some of that pain to make you a little bit more functional during the day. In some cases, they'll do nerve ablations where they're burning some of those nerves to block the pain. So instead of having this much pain in a day, you're having this much. This is tolerable and you can get through the day. This much makes you miserable and you can't do anything. So conservative treatment's maybe not your best option. That if you get choices and we can manage your pain, manage the healing so that that disc gets eaten up and resolved and that disc gets fully healed and repaired and patched, you can get through the day, get through the months, get to the point where the disc is no longer your problem. And our goals at the end of the day are going to be get that disc repaired and then get you strong enough, get that core strength and that stability so you're not causing excessive strain in that disc and re-blowing it again in future months or years.